Hello, my name is Julian. Welcome to The Secret Mind. Today, we're going to be talking to Margaret. 3 weeks ago tomorrow, Margaret had a hip replacement. 3 weeks ago today, I did a hypnosis intervention on her to remove her needle phobia. This is the first time I've spoken to her since. She's going to be telling us how she is. She's going to be telling us about whether or not the hypnosis session was useful, whether or not she coped with the needles that were coming her way immediately before, during and after the operation, and giving her the opportunity to describe the experience, particularly for the benefit of people who may be thinking about it or who are worried about it or have concerns about hypnosis in general. Hopefully people from doctors to pre-operative nurses to anaesthetists and also to any people who are facing operations and are concerned or worried or phobic about needles. Hopefully this will be useful for all of those people to learn something about what this process, how this process was seen through Margaret's eyes. Enjoy. Right, very good. I'm recording this, Margaret, just in case, I don't know if we might have some bits that might be useful to other people if you...
Right, okay, that's fine, yeah.
Yeah, a bit of fun.
Yeah,
so
no problem.
So that's the, well, nice to see you. This is the first question. So yeah. I haven't seen you for, is it knocking on 3 weeks now?
Almost, yeah, 3 weeks tomorrow, I think.
Yeah.
Yeah.
Now, so we maybe did the session about 3 weeks ago. Yeah. So, how are you?
I'm all right, yeah. I'm all right, yeah, doing well, yeah. Apart from I've got a lot of nerve pain in my good leg, which is a pain, but the other leg's doing fine. The new hip's doing fine, yeah.
Okay.
I'm just not sleeping. I can't sleep more than an hour and a half at a time. So
what keeps you awake? What is it that's...
I think it's just I can't get comfortable.
Yeah.
And then my leg hurts. I don't know.
New one?
Yeah. No, my other leg. Yeah.
Oh, okay.
My other leg's waking me up.
Okay.
So but it's all right.
So 3 weeks ago you went for your operation, just under 3 weeks ago, and was the surgeon happy with it in the end? Is he
he said everything went well and was pleased. So, yeah, no problems.
And follow up since then, do they see you again or do they
No, I see them mid-April, after 6 weeks. Yeah.
Did you see him after the operation, immediately after? Did they come round?
No, not really. he sent someone in his place who said, everything's fine, don't worry.
Yeah, okay. And how long did you stay in?
How long was I in? 4 days? 4 days.
4 days. Yeah. And what were they waiting for so that you could go home? Not that 4 days is a long time.
No.
But was there any...
No, I think it's just because I live on my own, so I think they just wanted to be sure that I was confident on stairs and could get in and out of bed properly and all that kind of thing.
So they road tested you before they
Oh yeah.
Yeah. And then since then, has anybody been round to see you? I mean, I'm old school, so in the old days the GP would come round after an operation, but even I'm not naive enough to think that's necessarily happened.
Well, I thought they might have a district nurse come round or whatever, but no, nobody. No, I had to go to the doctor's last Friday to get my staples out, which was a bit of an ordeal, but it was all right.
Yeah. What was the main part of the ordeal? Actually having them out, or just the palaver of getting them?
Just because I'm very squeamish.
Okay.
Apart from the needle phobia, I'm also very squeamish.
We didn't do an intervention for squeamishness alone.
No. So, but obviously the techniques help, for that as well. So yeah.
So that was it. That was it. 3 weeks ago, you were facing needles. You were facing needles because they were going to put a spinal, do a needle in your back, which you were less worried about because it was behind you, but still a bit of a concern that the idea of something coming into your body. And then you were facing needles on the day of the operation because they always like to put one in at least your hand or your arm, don't they?
Yeah.
And then you were facing needles because they wanted some post-operative injections to thin your blood to stop blood clots happening.
Yes.
So you had these 3 things. We did. So we met we started with a few audios, about 3 audio tapes, effectively, or what we used to call tapes.
Yes.
Put through to your WhatsApp. Thought it'd be most convenient just to sort of start the process going really, and then followed it up with a 2-hour live session the day before, where I sort of threw a lot of techniques at you. And had you ever done any hypnosis or hypnotherapy before?
No, I've done meditation before, but not hypnotherapy. No.
You'd had what before? Sorry.
I've done meditation before.
Meditation, yeah.
Like, yeah.
And had you, because she'd had this needle phobia for quite a long time?
Yeah, as long as I can remember. Yeah.
Had you ever considered hypnosis or hypnotherapy? Was it on the radar?
Because it's like, it's something that, I don't have I don't have contact with needles very often.
Well, that's the thing about avoidance, isn't it?
Then it always seemed like, oh yeah, if something was coming up, it's like, oh, I really should get this dealt with. But and then it's like, oh, well, it's finished now. And then it's, you don't have blood tests for another 5 years or whatever. So it's always been, yeah.
In terms of getting this dealt with, I mean, I've asked the same question to doctors and got, fairly grey answers. How do you get a phobia dealt with? How would you imagine you would have got it dealt with? What technique would you have used?
What, without hypnotherapy?
Not necessarily without, if that had occurred to you first, but I mean, I asked the GP I've asked a few GPs, what do they do when somebody comes to you with a phobia, which is a legitimate medical thing? We've all learned about them at medical school. And what do you do about it? And they usually look at me a bit blank for the next 15 seconds. And they go, oh, well, if it's about flight, I give them a Valium.
Before the flight. Oh, right, yeah.
And I'm thinking, oh, well, not all say that. Some say exactly the reverse, that they never do it. But they wouldn't consider something like this because it's not really on their radar, or people aren't coming to see them about it. So I'm just curious, how do people imagine that they get it sorted if they actually want it done?
I don't know. I mean, hypnotherapy was my first choice.
Okay.
For years, it's always been, that would be something that would help.
So you're something, it was on your radar a bit with the meditation. Yes. You also had other interests where you were doing reflexology, was it? Yeah, stuff like that. So to some extent, these are allied arts, aren't they? To some extent, sometimes some of these things. Yeah. So it would have come to mind, but you'd never had any.
No.
And was it what you expected?
I have to admit, I was a little bit skeptical when you sent me the audio things, and I thought, oh my goodness, I've only got 2 weeks. Is this going to be enough?
Yeah.
But then it obviously worked really well. So
to which I would usually defend that with, quicker is better. I mean,
yeah, you were so confident when I spoke to you, and you said, no, we'll get this done. Don't worry, it's going to be dealt with. It's fine. Don't worry about it. And I thought, right, he's confident about it, so yeah, go ahead with that. Yeah, just go with the process. Yeah,
and that's the thing, isn't it? You've got to buy into it a little bit, and it doesn't require belief. I don't think that's the thing where people get let up. Belief is irrelevant to me. It's irrelevant to you. I just, as long as people's lack of belief doesn't stop them participating, that's the only thing. But no subscription to any sort of supernatural thing. It's all I think we said it's hypernatural rather than supernatural. Ultra natural, it's extra natural rather than anything sort of spooky. And I think that sometimes gets people into heads, partly because it's the way it's represented in society, in newspapers, in entertainment.
It's the entertainment side, isn't it? Because I had a few friends saying, oh, I don't know, is it safe? Do you know who's going to be doing it? Do you know what they're going to ask you to be doing? I said, well, they're not going to ask me to be, pretending I'm a chicken or something. I mean, it's not going to be like that. It's not. It's not. Well, you might say a trigger word now, and I'll start squawking. But
the trigger word is "bok."
But I think people have got this image that that's what it's like. That you will be taken over and told to do things. And I think no, I think it's more like it was. It's you empowering me to think about things and do things for myself.
I think they're two different things. Have you ever been to a stage hypnosis show?
No, I've seen them, on telly or whatever. I mean, they used to have them, it used to be quite not common, but it was always making people do ridiculous things,
Yeah, yeah. I mean, there hasn't been that
And
many.
obviously, Darren Brown does things, but I mean,
Yeah, he
yeah,
does. Yeah, he uses a
yeah,
lot of hypnosis in his show now, Darren Brown, and he's also done healing in his show. Um,
right.
and done it presented like the old sort of vaudeville acts used to do. And of course, if you have a large population, he's usually got 2,000 people in the theatre, and if he suggests to the whole theatre or his chosen people that their back pain has gone, enough people are ready to
Mm,
accept that it has and report back that it has.
yeah.
You always wonder, which is great. Pain can go very quickly. I'm all for speed, and if they use it as entertainment, if people's pain goes away, that's fine by me. But you wonder how long those things last, and if they sometimes need a little bit more, settling in, and a little bit more,
Yeah.
just coming back to a little bit more focus on um, helping that individual out as opposed to moving on the next town and opening and setting up your show for the next theatre.
Yes.
But yeah, he gets closer to how it because he's a skilled hypnotist, but he's used it, I think, exclusively for stage stuff, and it is a different beast.
Mm,
And I think you mentioned there about the difficulty in choosing somebody and trusting them as well. And that is a difficulty for hypnotherapists in general, because there is no particular qualification that permits or excludes you from doing it, like many of probably the same reflexology possibly. And
yes. Yeah.
yeah,
Yeah. I mean, you're here with the governing body, but there's nothing, anybody can. Yeah. It's
yeah,
not like being a GP or a,
no.
medical.
And if
Anything,
and if some of this comes from society, probably where people did help each other a bit more out, and there was the healer at the end of the road, and some of them were, presumably quite skilled. Some of them, of course, maybe charlatans. That's the
Yeah.
difficulty. But yeah. So the experience was of the audios. You're a bit surprised to get those, but I hope that allow you to sort of engage with in your own time without anybody sort of breathing down your neck. That's what I sort of
Yes.
like about that idea, because I think it
Yeah.
probably is a bit of an odd thing. And then by the time we get to do the live stuff, you kind of know what we're doing really. That was
Yes. Yeah. And how that deep relaxation feels, how that
yeah,
state feels.
yeah,
You're conscious, but you're not.
yeah,
I don't know. Yeah. Yeah.
yeah. It's just
You're in
like
that. You're in that state, I suppose. Of
yeah, a slightly altered state. Yeah, a lot of hypnotists, and they have a difficulty with the word state. I don't. I quite like it. I think it's fairly clear that people are in a slightly different state of
mm,
sort of being open to stuff. But I think when they talk about state, and the reason they have their objection is they imagine this, as you say, with the stage hypnosis, as though they've flipped into this other alternative supernatural
yeah.
state, this very specific thing. But of course, they are in a slightly different state, in brackets, of mind. Oh, you have
Yes.
receptiveness, aren't you? In the same way they
Yeah.
might be with
Yeah.
the meditation. So I think some people's objection to the word state is a little bit extreme. I think it comes from maybe a little bit of embarrassment towards stage hypnosis sometimes, which is a skill in itself, but a different, a different sort of skill to entertain, and also one which few hypnotists and hypnotherapists would even have dared to try. So, before that, I sometimes think before people really, slag off other people's skills, they should maybe have a go themselves before they claim the moral high ground.
Yeah. Definitely.
But I have seen a lot of stage hypnotists myself, and I just to see well, there aren't that many around, even in the UK. There just aren't that many. So it's an interesting process, but different. Um, so, and the experience in itself, was any part of it uncomfortable, odd, or just too weird for you?
No. No.
Okay.
Um, there were times when you always get this impression that it's going to be sort of somebody saying, right, relax, think of this, think of that, don't think of this. When you think of that, think of something else.
Yeah.
And it wasn't like that. It was more because some of those audio things, I thought, oh, this is quite conversationalist. Really, it's quite quite chatty, quite. But
Yeah.
that's relaxing in itself, obviously. But you still get that message
Yeah.
of this is how you should be thinking, or put your mind to this.
Well, that's called conversational hypnosis, and I have a little bit of a. It wouldn't. You can do it just by people will just read scripts to each other. In which case, there's no need to meet live. You can just go. In fact, you can do it to yourself. There is an argument that all hypnosis is self hypnosis, but you are really just talking to someone or to some part of someone. And my preference is, although there's certain things you're trying to cover in the tapes and live, you're trying to hit all the beats, but you're trying to talk to another human being or another part of a human being, and that's best done in a slightly casual way, so it's not too formal, because I think that's the way we communicate. And also with if I can think of a joke, I'll probably make one, and not worry too much about, that's going to jump you out of this state that you need to be in and be frozen in, because that's not useful. I think we can risk that, because it'll send some chemicals around that I can just feel that in myself now. In saying that, I've just got a little thing, and my state has changed just by thinking of the idea of a joke. I can feel that in myself, and those are the sort of things that will fix in change. There's no better way to do it than with a laugh than to fix in change. It's a powerful surge of hormones, for want of a better word.
And I think it puts less pressure on me on the subject, because if you were being very formal and very sort of like, think of this now, think of that now, if your mind wandered slightly, you'd be thinking, oh no, I'm doing it wrong, even though you're in that hypnotic state, you'd still be thinking, I'm doing it wrong, I'm doing it wrong. Whereas somebody's talking to you, you've got time to pick out the bits that you need to and concentrate on those.
Exactly. Yeah. And obviously I'm always trying to make sure there's zero pressure on you, because that doesn't achieve anything. And but you'll feel it everywhere anyway. People want to be a good subject. So I think we did things where I was saying it doesn't matter if this doesn't work at all or doesn't seem to, because I know it will to some degree, even if you don't do the exact thing that the model person would do or expect. I mean, that would be boring if it was the same every time, everywhere. You're not dealing with that. It's your own internal dialogue that will probably help get the message through the cracks that aren't immediately apparent to me. That's why a lot of messages, I think, are very, very general. But if you make them too general, they're wishy-washy. If you make them too specific, they're wrong. I like to sometimes, when you're asking someone to go into their imagination, I'm ended up doing more talking than you are here. This wasn't the intention of this.
No, you need to be asking questions.
No, me just listening to myself. I'm not used to being an interviewer, that's why. Different set of skills. I have to look up a YouTube on it. So and now I've forgotten what I was going to say because I've distracted myself. So there we go. You're trying to get people to find their own metaphors that appeal to them. Sometimes it's nice for them to share one with you. And you can do that live. You can't do it on a tape, of course.
Of course. But
also, it's because it just helps you the way you understand people, someone's thinking, and also it's fun. It's got to be a enjoyable process on both sides. There's no point in doing it if it's not. It's a very human interaction, exclusively human interaction. There's no metalwork needles, no blood tests, anything like that. So when do you remember us doing the labeling the number system? We did a new exercise.
Oh yes, with different things. Yes, imagine them as different. Different materials or different colours. Yes,
So that developed out of that, and you can always develop these new stories. And then when I think you told me the number 4 was made out of crochet or something, I thought,
it's just like that's the image that came into my head.
I mean, that's so great. I mean, it just shows you to instantly see the pictures in someone else's mind is so great, and then it makes it a lot more easy to sort of manipulate those images and change them and illustrate how easily they can be changed. So, So that time we were playing with a scoring system for your fear of needles approaching you, and I was sort of. Messing around a bit by bringing my needles closer towards you to sort of partly test it out. And how would you feel about, say you were facing that operation tomorrow, so 3 weeks ago, and how would you feel about the needles on a concern about the needles on a scale of at 0 to 10, where 10 is the maximum possible fear of them and 1 is next to nothing?
I would
be honest. Just be honest.
I would probably say about a 3.
A 3. Okay, that's pretty good, because when I first asked you that, it was an 8.
Yes. Yeah.
At the end of the session, it was I've got you to a 2, and I don't think you'll go any further than that. And I think that's good reason. You don't want to take phobias away completely. A lot of them are there for pretty good reason. Needles are sharp. You know, if you're scared of dogs, they bark and bite sometimes. So most things are. It's just when they get medicalized, they get to a medical degree when they're just out, just that level of degree that really gets in the way of your life. And you're
so just out of control.
And what you're talking about earlier on, avoidance is a great solution. It's just I will not say it's a great solution. It can be a very successful solution, but but it limits life, which is not what we need. Well, so people who are agoraphobic, who stay indoors all the time and make sure they don't suffer symptoms, and of course that's the opposite.
You miss out on so much. Yeah, of course.
Yeah, particularly now in this rich world we have. So, so you feel as though it would be a 3 towards you if you had to do that, and do you feel as though, I think your main concern was your risk of collapsing and that looking pretty embarrassing? It's happened before. You think that would be a risk if you took the operation tomorrow?
I'd like to think not. No, I'd like to think that it would be the same as it was the last time I had it, kind of thing.
Yeah.
Which was absolutely amazing. I mean, I was waiting in the the little room beforehand, and they said, "Oh, we could take some blood." And I said, "Well, can you give me a minute?" She said, "Yes, it's on your notes that you've been having hypnotherapy. So 10 seconds. Hand it over my arm. Did the blood test. First time I've ever not hyperventilated or panicked or." I thought, oh God, I'm just like other people now. It's great.
How boring. Yeah. Now you're going to have to fill that void with something else more positive.
Yeah, but it was absolutely amazing. Yeah, I thought, oh my goodness, just this is a really good test. I'd been in the hospital for about 10 minutes by then, so that was great. Yeah.
So that was when they were taking some blood for you before the operation, or was it leaving the plastic tube in your arm as well?
No, just took the blood. Yeah.
Blood, and then did they put a plastic tube in you later on?
Yeah, that wasn't so easy, but only because she couldn't get it in.
Yeah. So take me through that. What happened and how many goes did she have?
Several. So she took my hand, which I gave up willingly, did the whole thinking about other things, whatever, and she was going, oh, I just can't get it in. Your veins are very tiny. I'm thinking, can you not tell me anything? Just do it. And in the meantime, the man took my other hand and he went, I'm in. It's all right. Done. So that was fine.
Well, they were having a go at you from both sides.
Yeah, so it didn't take, it seemed like a long time, but it obviously wasn't.
That's interesting, isn't it? So, and this is a common story, isn't it? And this is the sort of thing that can start phobias, and it's a similar experience to what you'd had before, because you told me that had happened before.
Yeah.
And the commentary of people sort of forcing in that phobia into you, really. That's the thing. What happens? That's what gets locked in. Those negative comments. About your veins.
Because obviously I don't like it for whatever reason. And then they're saying it's actually a very difficult thing to do. It's tricky. It's a problem. It's,
Yeah. So that's, the more skilled you are, the easier it gets. I've tended to think, it's like the old thing about,
She was the anaesthetist, and I'm thinking, if she can't do it, what's going on?
The old adage about being lucky. The old adage about being lucky, isn't it? And the harder I work, it seems the luckier I get. Interesting. Okay, so and that's the nature of things. 50% of doctors are at the top of the class, and 50% are at the bottom. That's just the way things work.
That's true. Yeah.
Stats for you. Anyway, so from point of view, somebody with a needle phobia, or potentially having one, they were at you from both sides with 2 needles in one in each arm.
Yeah.
Wow, that's that's a lot to tolerate. It's a lot to ask of anybody, really. And
then they put the spinal thing in, so that was,
Yeah. So that note that you were having hypnotherapy prior to going in, had a nice moment before you went into the anaesthetic room, but as soon as you were in, that note had been forgotten and they were on you like names.
No, I did tell them, and they went, oh yes. But but it was fine. It was,
So, that occurs to me. So the thing about operations is there's 3 parts to an operation: the pre-op, per-op, and the post-op. So you're post-op now, where the GP is visiting every day. Oh, sorry, I said he hadn't.
Oh, yes. In an ideal world. Yes.
In an ideal world, yeah, 50 years ago, yeah. Where and the per-op, which is taken care of by the surgeon and the theatre staff and the anaesthetist, and the pre-op, where you had some blood tests prior to the operation, probably a quick chat with maybe somebody anaesthetic. Did you have a chat with or formal anaesthetic, and maybe a nurse check now it's done? And they identified at that point a needle phobia, probably, did they?
Yes, yeah, it was on my notes, yeah.
And what were they going to do about that? What was their plan of action to deal with that potentially operation stopping problem?
They didn't seem to have a they said, oh, it's on your notes that you've been having hypnotherapy, so we'll give you some time.
In the pre-op though, before we'd done it, did they do it because you had did they identify the problem you might have with needles at that earlier stage, because you had your blood tests quite some weeks before, even before we started?
Oh yes, well, I fainted then when I had my blood test done, and came round with all the people there with all the oxygen and the heart monitors and
so before
and then I saw the anaesthetist after that on another occasion and told him that I was thinking about having some hypnotherapy or NLP or something to try and get over.
Yeah.
Because he was saying a spinal block would be the best way to do it.
Yeah.
And I thought, oh, that's going to be a massive needle. I'm going to have to do something.
Yeah.
It's not just a quick blood test or whatever. It's something that I don't want to think about, kind of thing. So I'm going to have to deal with it. So, yeah. So obviously he put on my notes that I was going to be, this was my plan.
Yeah. So you presented a plan to him. I wonder how people, when they identify that, what would be their plan of action for dealing with it? I think it would just probably be making a note of it and trying to be extra nice in the anaesthetic room, probably.
Yes, probably. Yeah. And maybe giving you 2 minutes and then thinking, oh, this isn't working. We're getting, she's getting very anxious. We're just going to do a general because it's easier for everybody. Yeah.
Yeah. Yeah, but riskier in your case. The risk was higher. Yeah, so that's it. That would be unfortunate, wouldn't it, to expose someone to what would be hopefully potentially an unnecessarily general anaesthetic, unnecessary GA, because of a failure to deal with an anticipatable, solvable problem.
Yeah.
Interesting, isn't it? It's how it sort of they get something that's quite common will be a bit overlooked, and in my experience in the past, these are the patients who frequently won't make it as far as the anaesthetic room because they'll have run off the previous night.
Yes. Well, it makes you wonder. You think, well, why don't they have a bank of people like you that they can just say, well, they're in your area, or these people deal with needle phobia or whatever else phobia you might have. Go and see these people. Get it sorted.
I think there's not that many people
should have them.
Say again.
I think GPs should have them. The number of times I've been in for blood tests and ended up on the floor or whatever.
Yeah, that's no good, is it? I mean, particularly something that can be dealt with. I think it's not part of usual medical training. I used to be an anaesthetist. I am currently a GP in the emergency room in primary care. So I did my anaesthetics. I certainly remember trying to sedate people when they used to come in the hospital the previous night. And when it was a warning, we would give them sort of strong tranquilizers to make them stay, and still going around in the morning and seeing an empty bed.
Oh, really?
No, they're very strong, these things. I was prescribing the strongest things I dare, and still they disappeared. And of course, it was a failure of treatment, and which is why I'm so interested in it now, because it is overlooked, and it's the cause of a lot of distress and the extra that affects people's lives. So, but also they don't maybe don't know about it until I or somebody like me probably tells them and introduces them. So maybe that's on me to make that a bit more out there. I do other stuff other than this, which is sort of limited me on it, but I think I may do it more because it seems to be where there's a lot of need, and so it is an interesting thing. So just out of interest, as a random sort of question, have you noticed any other effects in your life or outlook, where it might have had any impact or effect, just almost accidentally, maybe?
Not particularly, but I haven't been faced with much, I suppose. Well, I have, because I've got to deal with the fact that I don't want to look at the scar. But and that's quite good to have the relaxation part, to think, right, you're fine, everything's going to be all right. It's, you know.
Yeah. Do you still do it? Do you still sometimes listen to one of the things, or are you
Yes, yeah, I do.
Really?
Yeah.
We've made it into the archive.
Just to get that kind of, like, you know,
back into the
reinforcement of, you know, this is how it feels. Remember how it feels. Yeah.
And how did you deal with the injections afterwards? Did someone come and help you with those, or because you had blood thinging?
They did them for me in the hospital.
Yes.
And I couldn't do the first one in my stomach, so they did it in my arm. But she said, "Oh, it's going to hurt in your arm. Oh, so you've got more muscles or whatever." So that wasn't a nice thing, but it did hurt. And then this other nurse did it.
Maybe if she said it wasn't going to hurt, it wouldn't have hurt.
And then this other nurse came and she said, and it was done like in 2 seconds. I let her do it in my stomach. I thought, right, I can do this. Just think of, you know, all the training of your mind kind of thing. And she did it, and it was over in 2 seconds. And I said, "Oh, the other nurse took so long." She said, "Well, I don't know why, because they're really, you know, so quick."
Yeah, it's just
I can't brought them home. I'm on tablets for it, so I thought I can let somebody else do it, but I don't think I could focus on not being worried about the needles and then doing it myself at the moment. So
so they put
that's just a step too far.
But you could, Margaret.
I probably could.
But they've got you on blood thinning tablets now anyway.
Yes,
so that's taken over from that now.
Yes, that's taken over from the injections. So, yeah.
Very good. Okay. And what's the question I wrote to myself? Is there any, if you had to use one word to describe the difference between before and after, what would it be? That's quite a...
Oh, one word. I suppose I'm just more calm about that kind of thing. Yeah.
Are there any
I think it's just a you know, sort of lessening of anxiety around the whole thing, really. Yeah.
And the whole intervention, are there any negatives to it, to the process? I noticed that when I used some new premises, and I hadn't quite I knew, but I hadn't quite realised to warn you there were stairs there, and of course you're uncomfortable with it. I hadn't I factored that in. I don't know what I would have done about it other than the fireman's lifted you up, but
that's all right. I've got stairs in the house, so I can do the stairs. That's fine. It just takes me a while. Yeah.
So other than that, are there any negatives to the process that you...
No, none at all. No.
It's a pity. I mean, because that's the great thing about it. It's free of side effects, and it was a nice set of premises that we used. So
it was a lovely room. Yeah,
it was lovely, wasn't it? Yeah. And is there anything you want to ask me?
Do you think I need to just re-listen to those things to kind of reinforce it for, you know, is it something that I can think, right, okay, that's dealt with now. I'm over my phobia.
I think it can go...
Is it a thing that needs refreshing kind of thing, you know?
I think it can go either way. I think the hope is that you get into a spiral where it just blows the phobia out and it really just becomes an irrelevance, and you just can sweep it away with an old brew and just move on and fill that space with something else. I think occasionally sometimes people do need a little bit of reinforcement just to remind themselves where they were. Practice always makes permanent. So it doesn't hurt to do that. So it's either way. You just sort of play it by ear a little bit. This is a funny one in the hand. You had a particular thing you needed. Now your subconscious mind essentially knows you can control that. You know you're in control of it. That message will grow and grow and spread through your body. So you hopefully, I'd expect that there'll come a point where you can't really remember why you wouldn't have been able to control that. And your body can't quite remember it either. And it just becomes an irrelevance. And that was the person you were, and this is the person you are now and in the future. And if you want to feel uncomfortable about other stuff in the future, then watch the news. Or
yes, there's plenty of stuff out there, isn't there?
There's plenty of stuff to fill it in, rather than waste your energy on feeling that. But yeah, using the tapes over again. I think I can't quite remember what I put on the audios, but there will have been you could look at them just on putting you in a standard relaxation sort of a zone that just helps you recapture that. Nothing wrong with doing that at all. We should all probably take 20-30 minutes for ourselves every day and do a bit of something like that every day anyway. So no harm in doing it. So people can fall, I think, in two categories. Your hope is to eventually blow it away so it's irrelevant, and I think when you're at a 3, you're getting there. And you're in the right sort of ballpark. You've got the job done. You know you can deal with it. You know this is under your control. But no harm done in listening to a bit more, or just you're teaching yourself self-hypnosis is what you're doing. There's no magic coming from me or anything else or from the universe. You're teaching yourself to sort of train yourself in self-hypnosis. There's other ways of doing it, music and stuff like that. Once your body can automatically recite the messages to itself that it knows it needs to. So no harm done either way. But it's nice to have it as a resource, and if it's feel as though it's useful at a moment, then dig in.
Great.
Great. Well, that's great. Well, thanks for doing that, Margaret.
No problem at all. Much appreciated. Thanks very much for your help. It's been I couldn't believe it when I went in. It was just like, oh God, it's just such a weight lifted off my shoulders kind of thing. It's just brilliant. Yeah. Great. I thought, there's no other things going on without having that on top, and it was just fantastic. Yeah.
You're right. There's always something else. So
I had a bit of anxiety beforehand, thinking, oh gosh, I don't know if this is going to work.
Yeah.
Because obviously we'd only seen each other the day before.
That's right.
And I felt very positive, but then when I got in there, I thought, no, it's great. It's working. It's
Yeah. Well, your subconscious is working for you 24/7. That's the thing. So it was still working for you through the night. The operation wasn't till morning. We had bags of time.
Loads of time. Most of it whilst I was sleeping. No, I think it was a lot of obviously when you were, there. But it was wonderful. Thanks very much for that.
Very good. Well, you're welcome. Onward and upward, Margaret. Thanks for doing this. And anything you need, give us a call. But other than that, I wish you the best in your recovery. And
Thank you.
Keep going.
Okay. Well, good luck with your singing. Yeah.
Oh yeah, this is my Fiddler on the Roof beard. I'm thinking of having it trimmed today because I've got to go and do a shift at the RVI tomorrow. I'm thinking I should do that, but I've never gone to anywhere where that trims beards before, and I know I can't do it. So I don't.
Well, there's plenty of barbers on the West Road.
I know, but I think I don't want it trimmed that much because I need it for the.
You just want,
dilemma.
It's probably fine. Get your mask on, you'll be all right.
Yeah. All right, Margaret, take it easy.
All right. Thanks very much. Okay, take care. Bye.
Bye.